The history station knee pain for MRCS OSCE exam. Scenario, uh, imaginary scenario. There will be a footballer who had a knee injury, right or left, years ago. Had knee operation that he has no idea about and developed worsening right knee pain 1 month ago. Hello, I'm Ali, one of the surgical doctors working here. May I confirm your name and age, please? Hello, doctor. My name is Adam. I'm 56 years old. Nice to meet you, Mr. Adam. I will be your doctor for today. How can I help you? I have this pain in my right knee, doctor. I'm really sorry to hear that. Don't worry, you are in safe hands. Where did you feel the pain? Could you please point to the side? The pain is mainly in my right knee. And the patient will point to the right knee. It's here, doctor. It's been bothering me a lot lately. Does it move anywhere, Adam? No, the pain stays in my right knee. It doesn't seem to move to the other areas. Alright. When did you first notice that pain? Did it start suddenly or gradually? I first noticed that pain about a month ago and it started gradually. It wasn't too bad at first, but it has been getting worse over time. Sorry to hear that. Did it come and go? Had this changed recently, Adam? Initially, it would come and go, especially after physical activities. But recently, it's been persistent and doesn't really go away. Is there any specific time during the day that the pain increases? The pain usually gets worse in the evening and at night. Okay. Is there anything that makes this pain stop? Resting and avoiding putting weight on my right knee helps to ease the pain a bit. That's good to hear. Is there anything that makes the pain increase? Walking or climbing stairs tend to make the pain worse, doctor. Could you please describe the pain for me? Is it colicky, cramping, or stabbing? The pain feels more like a deep ache and sometimes a sharp stabbing sensation, especially when I move my knee. Sorry to hear that, Adam. How badly is this affecting your day-to-day life? It's been quite challenging. The pain makes it difficult for me to walk comfortably, and I've had to cut back on activities I used to enjoy. That must be hard, Mr. Adam. Yeah, doctor, not a fun thing. If you had to rate the pain from 0 to 10, with 10 being the worst pain you can imagine, how would you rate it? I would rate it around 8. It's quite painful and really impacts my daily life. I deeply understand that, and I'm really sorry for what you're going through. Does the pain present all day and increase at night? Yes, the pain is there throughout the day, but it tends to get worse at night. Did you notice any change in shape of your knee? Was there any history of trauma? I haven't noticed any significant change in the shape of my knee. I had fall on my right knee several years ago. Did you experience giving away when walking? No, I haven't experienced any giving away sensation in my knee. Did you experience locking of your knee? Yes, there have been times when my knee feels locked and I can't fully bend or straighten it. Have you noticed any stiffness in your joint when you wake up in the morning? And how long does that for? Doctor, I haven't noticed significant morning stiffness in my knee. Have you noticed the swelling of your knee, redness, or any discharge, Mr. Adam? My knee has been slightly swollen, doctor, and sometimes it looks a bit reddish, but there is no discharge. Have you noticed weak or numb legs? Do you have back pain? I haven't noticed any weakness or numbness in my legs, and while I have occasional lower back pain, I don't think it's related to my knee pain. Okay, Mr. Adam. Have you noticed any rashes anywhere on your body? Any diarrhea or painful red eyes? No, I haven't noticed any rashes or experienced diarrhea or painful red eyes. Have you noticed any significant weight loss over the past few months? And how is your appetite, Mr. Adam? No, my weight has been stable and my appetite is normal. Do you have any other medical condition? Do you see your GP for anything or ever have surgeries? I don't have any other medical condition and I haven't had any surgeries in the past except for one surgery that I don't remember the details. It was on my knee too. Do you take any medication, Mr. Adam? I'm currently taking over-the-counter pain relievers, occasionally for knee pain, but no prescription medication. Do you have any allergies? Do you mind if I ask personal questions? No problem at all. What's your occupation? I work as a receptionist at a local office. Who is at home with you, Mr. Adam? I live alone, doctor. Do you have any difficulty with the stairs? Yes, I have some difficulty with the stairs because of my knee pain. Do you smoke, Mr. Adam? I used to smoke, but I quit 2 years ago. That's good to hear. Congratulations. Do you drink alcohol? No, I don't drink alcohol. Is there anyone else in the family who has had a similar problem? Not that I'm aware of. Before I go any further, Mr. Adam, could I ask what do you think the cause is? I suspect the fall I had might have triggered this knee pain. What are you most concerned about? I'm worried that it might be something serious like osteoarthritis. What are you hoping us to do for you, Mr. Adam? I'm hoping you can diagnose the cause and suggest the right treatment to alleviate the pain and improve my knee function. Don't worry, we will do our best. Do you have any shortness of breath or chest pain? No. Any belly pain, Mr. Adam? No. Any problem with the wee? No. Any muscle or joint pain? No, I haven't experienced muscle or joint pain besides my right knee pain. Anything else you want to add? Not at the moment, doctor. I think I've covered everything related to my knee pain. Okay, Mr. Adam, thank you for providing all this information. Given your history and symptoms, it's possible that you may be experiencing traumatic osteoarthritis in your right knee due to your previous injury. I will carefully review everything and perform a thorough examination to confirm your diagnosis and understand your condition better. We will work together to find the best treatment plan to manage the pain and improve your knee function. If any new concern or symptom arise, don't hesitate to let me know, Mr. Adam. Thank you. I appreciate your attention and understanding. I hope we can find a solution to this knee pain. Discussion. But before going to the discussion, I made 2 mistakes in the history. Those who are intelligent are welcome to comment the mistakes. And I'm gonna post the mistakes in 2 weeks. Discussion. As you know, after you finish your history taking, then you will have a discussion with the examiner, the consultant. The first question, he will ask you to present your patient. So make sure you practice every single case, because this will give the consultant the first impression about your performance. Okay, doctor, present your patient. I took a clinical history from this patient. Mr. Adam is a 56-year-old male who reported persistent and worsening pain localized to the right knee, which began gradually in the last month. The pain is described as deep ache with occasional sharp stabbing sensation, rated around 8 out of 10, impacting daily activities and increasing in intensity during the evening and at night. He has history of right knee injury several years ago. Morning stiffness and neurological symptoms were not observed. Okay, doctor, what are your differential diagnoses? Firstly, I will consider traumatic osteoarthritis being the first and most probable diagnosis. I also have to consider other possibilities like meniscal injury, anterior cruciate ligament injury, rheumatoid arthritis, septic arthritis. It could be referred pain from the back, and I will consider also extraintestinal manifestation of inflammatory bowel disease, and lastly malignancy, bone or soft tissue tumors. How will you investigate your patient? According to my physical examination, I will determine my priority investigation. As a general rule, I will perform X-ray to assess joint structure, osteoarthritis, and fractures. I may need to do MRI to evaluate soft tissue, ligament, or meniscus. I may also need to do blood tests to check for any inflammation or autoimmune condition. If I'm suspecting septic arthritis, I may need to do joint aspiration for analyzing of synovial fluid. Arthroscopy for direct visualization and minor intervention. Bone scan if I want to identify bone tumor or infections. I may need to do also ultrasound to assess for soft tissue structure, tendon, ligament injuries. And lastly, CT scan, which will give me detailed image of bones and complex fractures. As we said, these investigations will be arranged according to the history and clinical examination. How will you treat your patient? Firstly, conservative management, which include over-the-counter pain relievers like acetaminophen and non-steroidal anti-inflammatory drugs. It also includes physical therapy to improve knee strength, flexibility, and stability. May also encourage lifestyle modification, including weight management and activity adjustment. And the last component of conservative management is assistive devices like braces and orthotics for additional knee support. This is example for knee orthotics. Then medical intervention. I can give corticosteroid injection into the knee joint to reduce inflammation and pain. And I may also prescribe medication for more severe pain or inflammation if necessary. A last component of the treatment is the surgical option. Arthroscopic surgery for severe cases to address damaged tissue, ligament repair, or removal of loose bodies in the joint. Good luck. As I said, I would be happy if you can post the 2 mistakes that we made in the history. And if you have any comment or suggestion, add it in the comment section. I follow this every day. Thank you and good luck with your study.